Where people living in rural parts of the country are facing difficulties in accessing healthcare services due to the poor road network and the low number of health centers. The World Health Organization ranks South Sudan among the countries with the worst health infrastructure. Now, the Eastern African countries' fragile healthcare system has been worsened by insecurity in the country. And here's more details of that in this report.
5 years of flooding have destroyed the health infrastructure of Bentiu, a region in the north of South Sudan. People here depend on this health facility run by a non-governmental organization known as Care International.
We depend on this facility for all medications. Any medicine that this facility doesn't have, we cannot get because we are cut off from the main town where the drugs are.
Angelina's situation is similar to that of many across South Sudan. Healthcare workers here say the situation is not getting any better.
There's no way of bringing supply, and then there's no way of beneficiary to come to the facility. Now we have all those challenges because of this flood. Children have no access to come to the facility.
In areas where there are no floods, the road network is very poor. The situation has been exacerbated by the insecurity across the country. South Sudan's maternal, infant and child mortality rates are some of the highest in the world, and life expectancy is low. Health workers are poorly paid. A doctor in South Sudan earns about $50 a month. That's due to inflation caused by the economic crisis that has resulted from 5 years of civil war.
We all have to work together. It calls for teamwork. It calls for us to brainstorm. It calls for us to put all our ideas on the table and see how best are we going to move the healthcare sector together.
China has built new facilities at Juba Teaching Hospital at a cost of $33 million. The World Health Organization and other partners have also put up new health facilities in parts of South Sudan. But for people like Angelina Nyakuma, accessing those health facilities may not be possible in the near future unless the security situation is addressed and key infrastructures like roads are worked on. Patrick Koyet, CGTN, Juba, South Sudan.